Hey guys, Lance here, and today I'm going to talk about the pros and cons of Medicare Advantage plans. But before I start, I just want to say, I know Medicare can be very complex and difficult to wrap your head around a lot of these things. So if you'd like to speak with a licensed Medicare professional to go over your Medicare options with regards to your specific situation, please feel free to call the number on the screen anytime. So Medicare Advantage, also known as Medicare Part C, makes it possible for people with Medicare Part A, also known as hospital insurance, and Part B, medical insurance, to receive their Medicare benefits in an alternative way. So let's take a closer look at some of the important pros and cons of a Medicare Advantage plan, and let's start with the pros of Medicare Advantage plans. So first, Medicare Advantage plans often provide more benefits than you would receive under original Medicare. Medicare Advantage plans must offer at least the same level of coverage as Medicare Part A and Part B, and many plans offer added benefits. These might include coverage for routine vision care, hearing aids, routine dental care, prescription drug coverage, and fitness center membership. Secondly, Medicare Advantage plans may cost you less. If you enroll in a Medicare Advantage plan, you continue to pay your Medicare Part B premium, and you may pay an additional premium. The insurer determines your Medicare Advantage plan's premium, which can vary from one Medicare Advantage plan to another. Some Medicare Advantage plans may have premiums as low as $0. Your cost sharing may also be less under Medicare Advantage. For example, if you visit a primary care physician under Medicare Advantage, you may pay a copayment of $10. However, if you visit a primary care physician under original Medicare, you may have a coinsurance of 20%, which could be more than $10. Also, a Medicare Advantage plan limits your maximum out-of-pocket expense. Once you have spent that maximum, you pay nothing for covered medical services for the remainder of the year. Original Medicare does not provide a maximum out-of-pocket cap, so your potential expenses are limitless. Now, often a Medicare Advantage plan can be less expensive than comparable coverage you would receive if you stayed with original Medicare. To get all the benefits of Medicare Advantage with original Medicare, you would also need to enroll in a standalone Medicare Part D prescription drug plan, as well as a Medicare supplement plan. And then third, Medicare Advantage plans coordinate care among your healthcare providers. Typically, Medicare Advantage plans are managed care and have networks of contracted healthcare providers. An example would be Health Maintenance Organization, or HMO, Medicare Advantage plans. These HMO plans require you to select a primary care physician who helps to coordinate your care. Medicare Advantage plans that include prescription drug coverage may also have medication therapy management. This care coordination can be a convenience and a valuable aid to your health. And then finally, Medicare Advantage plans can serve as your one-stop center for all your health and prescription drugs coverage. Most Medicare Advantage plans combine medical and Part D prescription drug coverage. Many also coordinate the delivery of added benefits such as vision, dental, and hearing care. You may prefer the convenience of working with one plan administrator. So now let's move on to the cons of Medicare Advantage plans. First, Medicare Advantage plans may limit your freedom of choice in healthcare providers. With the federally administered Medicare program, you can generally go to any doctor or facility that accepts Medicare and receive the same level of Medicare benefits for covered services. In contrast, Medicare Advantage plans are more restricted in terms of their provider networks. If you go out of network, your plan may not cover your medical costs, or your costs may not apply to your out-of-pocket maximum. Next, Medicare Advantage plans coverage for some services and procedures may require doctor's referral and plan authorizations. Medicare Advantage plans try to prevent the misuse or overuse of healthcare through various means. This might include prior authorization for hospital stays, home healthcare, medical equipment, and certain complicated procedures. Medicare Advantage plans often also require your primary care doctor's referral to see specialists before they will pay for services. And then number three, Medicare Advantage plans have specific service areas. Most Medicare Advantage plans have regional rather than nationwide networks of participating providers. To enroll, you must reside in the Medicare Advantage plan service area at least 6 months of the year. If you divide your time between homes located in different areas, this requirement might be difficult to meet. So the bottom line is that Medicare Advantage plans may provide more affordable coverage than you would receive otherwise. The trade-off is that you have to follow the Medicare Advantage Plans rules to receive payment for covered services. So if you're getting ready to enroll in Medicare for the first time, or if you're already enrolled in Medicare, one of the most important things you can do is to review all of your options as Medicare plans and benefits are changing and updating each year. Now, if you're enrolling for the first time, it can be very confusing trying to figure out which plan will be right for you. And if you're already enrolled, it's a good idea to review your coverage each year because you could be missing out on some important benefits offered by the major providers in your state. By reviewing your coverage, you may be able to upgrade your benefits without having to pay more money. But in either situation, this can be confusing to try and figure all these things out on your own. Fortunately, there is a very simple way to get the most recent benefits without having to call several insurance companies or even spend endless amounts of time scrolling through the internet. There's a completely free, no obligation helpline to give those enrolling in Medicare for the first time or those already enrolled in Medicare the information they need to take advantage of all the most recent benefits available to them. So if you're wondering about how to sign up for Medicare and finding the right plan for you, or if you're worried you don't fully understand your current Medicare plan, or maybe you're just curious about the other types of benefits you could get at no extra cost. Either way, you can go ahead and call this toll-free number, which you can see on the screen. Also, we'll put it down in the description below. Then once you call, you'll get the chance to speak with someone who will be happy to answer any questions you might have and find you the best coverage available for you and for your particular situation. And even if it's outside the annual enrollment period, it's still very easy to switch your plan if you'd like to do so. Also, if you have any questions you'd like to post down in the comment section below, we love getting to answer as many of those as we can. Otherwise, I hope this video was helpful and I'll look forward to seeing you in the next video.